Hello, everyone, and welcome to this session of Latin American Success Stories and Challenges. It's a pleasure for me to share this session with Fabiola Martinez, who is one of the greatest representatives of clinical and biomedical engineering worldwide. It is for me a pleasure to talk about innovation in biomedical and clinical engineering in Latin America. And for starters, it is not easy, and it has historically not been easy to innovate in Latin America. Why? Well, amongst many other things, because there's been little to no financial support for research and development. Whereas in other areas of the globe, there is a significant fraction of the GDP devoted to research and innovation. In Latin America, the percentage has been significantly low. This doesn't mean that people don't innovate. On the contrary, because of these limitations, people have learned how to do more with less. And creativity is one of the greatest assets that Latin America actually has. So if we look at health tech startups in Latin America, we're going to see two things. First, startups are mainly focused on provision of care. So prevention, diagnosis, and treatment. And the larger countries in the region are those that have larger, mature ecosystems, with the exception of Trinidad and Tobago, that has made some significant investments in R&D, and that is proven a positive outcome. So if we look at startups in Latin America, we see that so far there is only one unicorn, but there are several soon-to-be unicorns. And where are those unicorns or soon-to-be unicorns from? Were mostly Brazil, Mexico, Argentina, and Chile. However, I'm going to talk about other markets where significant things are also happening. And one reason to be hopeful is because private investment for startups have been significantly increasing in Latin America. And as more money comes to the region, more money would be invested in new ventures that will help develop the technology ecosystem. So building an innovation ecosystem, it's not easy. We need a lot of pieces that need to articulate and join together for this to happen. We need not only the teams, and we have great qualified people in Latin America, but we need the processes and we need the services to support these processes. Again, the larger countries are the ones that have matured the development of this ecosystem. And there are specific regions, specific cities within each of these larger countries where you see significant entrepreneurial education, investment in R&D. You see support for startups, including tax incentives and access to venture capital. So as this improves in other countries and other cities in other regions, we will see how new companies start developing in Latin America. So I've been doing clinical biomedical innovation for many years. Originally, when I was in Venezuela, I was part of the health technology group at Simón Bolívar University. We developed what we called at that time innovation as a service. So how a company, how a hospital could come to us, the university, to request the solution for a problem, to request the evaluation of a necessity. And we as a team would get together, faculty and students, to tackle and solve that problem. So we got, as a group, as a university laboratory, accredited under ISO 13485 in 2008. And the lab started up two companies, Techno-Clinical Solution for outsourcing of clinical engineering services, and Cellulab, cellular engineering, that was the first tissue engineering laboratory in Venezuela and one of the first in the region. We also work with different companies to accelerate it. For example, Calvent Medical, which was a manufacturer of osteosynthesis devices, worked with us to help us improve their manufacturing processes, their quality assurance, and also allow them to get certified under ISO 13485. The ecosystem in Venezuela, however, it's pretty much dead at the moment. Bad policies, bad governments actually produce a brain drain. And not only me, but many of my very bright colleagues, most of my peers at Simón Bolívar University, had to leave the country and are producing some significant changes in other parts of the world. A very mature ecosystem is Mexico. Many of you know our partner and friend Luis Fernandez, who has developed TINC. TINC is one of the best CMMRs if you want to maintain your devices, if you want to keep the stock and the inventory. Well, Luis, as a clinical engineer, understands the need of the engineers and has developed the software to serve these needs. But Luis is just one of many who have benefited from the very productive ecosystem in Monterrey, Mexico. In fact, Carlos Slim, one of the richest men in the world, is part of this ecosystem and one of the driving forces that make Monterrey one of the capitals of innovation in Latin America. But Luis also benefited from another very mature ecosystem, and that is the Chilean startup ecosystem. And in Chile, many other companies have flourished. Here is another Luis, Luis Santiago, who benefited as well from the ecosystem in Chile developing Pegasus. Pegasus is an electronic health record that's specifically suited for oncological care and for clinical research. And they have made a significant impact in the region, expanding from Chile and, for example, the National Oncology Service of Ecuador. It's currently using their software to solve their needs. Even though I had not mentioned this one before, the ecosystem in Colombia is blossoming. And one of the most mature places where I have the pleasure of active collaboration is Medellin. Medellin created a bioengineering consortium where public and private universities, along with public and private research institutions, are working together to develop new technologies and new solutions. Companies are actively engaged with the universities in developing these solutions. And here we can see how one of the universities, the Escuela de Ingeniería de Antioquia, has worked with multiple companies and has developed multiple patents. In fact, if you want to study a master's or a PhD at EIA, you have to have a corporate sponsor who is providing you with the means to pay for your study and with the research problem that you are going to solve. From this very interesting ecosystem, companies like Smartiva have been spun off. Smartiva has a closed-loop anesthesia device that is certified by the Colombian FDA and is used routinely in surgeries throughout Colombia. Here I am with Juan Manuel Fernandez, who's currently studying at Johns Hopkins Carey Business School, getting an MBA in clinical research innovation and working on getting his Smartiva device through the FDA pipeline so that the device can also be accredited as software as a medical device and closed-loop anesthesia in the United States of America. Still a long way to go, but this is the proof that an ecosystem can actually make change. So where do we go from this? If you want to foster innovation, if you want to create an ecosystem, you need to align your values. You need to explore the opportunities. You need to identify and understand what advantages you have in your region that can be converted into new technology developments. Once you do that, you engage and you train both your universities and your companies so they can work together in fostering a co-creation environment that is opening, that is welcoming for collaborative, co-creative innovation. This is the path to progress, and this is the way to the future. Thank you. If you want to reach out to me, there is my personal email. Don't hesitate in contacting me, and I'm looking forward to helping you build very successful innovation ecosystems throughout the world. Have a wonderful day. Goodbye.